Welcome to all our witnesses. Today we're here to assess the effectiveness over the past several years of key centers within the Centers for Disease Control and Prevention. With an agency that receives nearly $20 billion in annual funding and plays a critical role in assisting our states and localities with preparedness and response efforts, it is essential for Congress to evaluate the job the CDC is doing to achieve its mission. I still believe today the CDC is the preeminent organization in the world for the role that they play. The agency's mission states that it's designed to, quote, work 24/7 to protect America from health, safety, and security threats, both foreign and in the United States. To accomplish our mission, CDC conducts critical science and provides health information that protects our nation against expensive and dangerous health threats and respond when they arise. To know and fully understand the CDC's mission is to realize the history of the agency. Originally established in 1946, the CDC, in effect an extension of the Department of Defense, and was created to help track malaria internationally. Today, the agency operates 23 different centers, institutes, and offices that all have different focuses. We will hear from the directors of 6 of these centers today about their role in executing the CDC's mission and their vision for the future. Since the COVID-19 pandemic hit our shores, Americans have experienced historic rises in drug overdoses fueled by a tragic rise in illicit fentanyl being trafficked across our southern border, China, Mexico, into the United States. Overdose prevention remains one of the CDC's core responsibilities, but data show rising year-over-year overdose rates and indicating the overdose prevention efforts require some scrutiny. This includes whether federal overdose prevention and response efforts can be streamlined across agencies to help better direct resources to communities most in need. The nation now potentially faces a threat with the H5 avian influenza, which is impacting poultry and dairy farms and has infected 10 farm workers across the United States. While the avian influenza does not currently present imminent harm to humans, my hope is the CDC learned some lessons, as we all did, through COVID-19 and will be adequately prepared to respond if needed. That the CDC received over $1 billion in direct funding for a data modernization initiative that has yet to bear fruit. There are outstanding questions about how the funding is being utilized, how much is being utilized, and for the purposes it's being utilized. The agency continues to seek additional data authorities despite operating over 100 surveillance programs and skepticism around the authorities they already have from the American people, including in my district. We need strong answers to justify why these authorities are needed. While I do give the agency a lot of credit for taking the steps towards much-needed reform and reorganization, I do believe continued increased reflection is needed, particularly for an agency that technically remains unauthorized. The American people deserve a CDC that is accountable to its core mission, preparedness and response to infectious diseases. Otherwise, we risk repeating past failures and placing millions of Americans' lives at stake. I yield.